Hello, so this is procedure 50 slash 1 or procedure 50 hyphenated 1, and I am going to, this is saying, following the steps listed in the procedure, locate specific information on medications in a PDR or other drug reference. It says, please look up metoclopramide hydrochloride using the PDR net and find the alternative name, generic or trade, the indication for the use, recommended dose, and the route and the common side effects. So the first thing I'm going to do is I am going to go into another web page, and I'm going to just go into pdr.net. So what I did is I just copied the drug name that's in Canvas and just paste it into the pdr.net just so that I don't mess up the spelling, because I probably will. So I just copied and pasted the drug into my PDR. Right here, it says type drug name here, and I get everything that I need to know about this drug. I really like pdr.net because it's not everything that you need to know is in one page. You don't have to go to another page and find the dosage, or go to another page and find the side effects. It's all in here, so it's really useful for finding everything that you need to know about this drug. So this is how it looks like. Has a bunch of information regarding the description, the type of class that it's considered, the indications, how it's applied, and all of that. So now that I'm in here, I'm going to be finding the alternative name, because that's my first task. I have to find the alternative name, and right when I scroll down in here, you can't really see it. Okay. So right when you scroll down, it gives you the DEA class, the description, and then it gives you the common names. It says the common brand names that this drug has is Metozolv and Reglan. So let me just zoom into this a little bit better, just so you guys could see it. Okay. So that would be the alternative names that you can find it in. It could be either Metozolv or Reglan. So there's two common names for this certain drug. This would be the trade name that is for this certain drug. Now that I've found the alternative name, I'm gonna look up the indication for the use of this drug with the recommendation dose and route. What I really like about the PDR is that it gives me the dosage and indication. So for every single indication this drug is used for, it also gives you the certain route that it's going to be given in and the dose. So for example, this drug, so metoclopramide, I can't say that word. Metoclopramide hydrochloride. One of the ways this drug is used for is to treat post-operative nausea and vomiting. So basically, it's to treat nausea and vomiting after a surgery, as well as post-operative nausea vomiting prophylaxis. So for this certain treatment, for this certain if a doctor were to use this to treat the post-operative nausea and vomiting, it gives me two ways that this drug could be given at. For example, it could be given intravenous or intramuscular. So it could be given intravenous or intramuscular. And it gives you the dosages that you would give to an adult and to a child. So for example, if I were to give this to an adult if I'm treating an adult for post-operative nausea vomiting, I would give them a 10 milligram either intramuscular or intravenous near the end of the surgical procedure. And I would repeat every 4 to 6 hours as necessary. If required, a 20 milligram dose may be used. And if I were to give this to a child or a teenager, it says that dose regimens administered in clinical practice and studies vary and include 0.1 milligram dose IV intravenous or 0.15 milligram dose intravenous and up to 0.25 milligram dose intravenous for early within 6 hours. So this is just for if they were treating this for post-operative nausea and vomiting. Another indication or another reason this drug is actually used for is for emulsogenic chemotherapy-induced nausea, vomiting, and chemotherapy-induced nausea. So basically, to induce nausea and vomiting before chemotherapy. So the only way this drug could be given for this reason, for induced nausea, vomiting, and chemotherapy-induced nausea, the only way it could be given is for intravenous. And it says it right here. And it gives us the dosages that you would give an adult and a child. For an adult, it is 1 to 2 milligrams. Intravenous infusion given 30 minutes before beginning chemotherapy and repeated every 2 hours for 2 dosages. And then every 3 hours for 3 doses. And it says the initial 2 doses should be 2 milligrams if highly emetogenic drugs such as cisplatin or dicarbazine are used alone or in combination. And it also gives us the dosages that you would need for a child or a teenager. This drug actually it is used for a variety of things. It is used for as we saw, the post-nausea, after surgery for induced nausea, vomiting, and chemotherapy-induced nausea, prophylaxis. It is also used to facilitate intestinal intubation and for use as a diagnostic aid during a gastrointestinal radiography, for treatment of symptomatic gastroesophageal reflux disease known as GERD. It gives you, it's used for that, and it's also used for the treatment of idiopathic or post-surgical gastroparesis or diabetic gastroparesis, which this drug has a lot of use. It has a lot of use for a lot of things in different ways. And for every single use, there's a different way of giving the medication, whether it's oral, whether it's intravenous, intramuscular. There's a lot of ways. And the PDR gives us and tells me how it could be given. All right. So we got the indication for the use, recommended dose and routes, and now we're going to do the common side effects. So the common side effects for this certain drug, the thing that I really like about the PDR is that it gives you the symptoms that you may have or the adverse reactions from mild to severe. So some of the mild symptoms that you could get when using this drug. It could be drowsiness, restlessness, fatigue, nausea, headaches, vomiting, diarrhea, dizziness, breast enlargement, menstrual irregularity, insomnia, tremor, and it actually says like, it says like, for example, it says fatigue early, when you can get it. One of the moderate symptoms that you could get is hallucinations, confusion, depressions, dyspnea, infertility, edema, hypertension, hypotension, fluid retention, jaundice, elevated hepatic enzymes, and there's more of the list that you could get. And for severe symptoms, you could get heart failure, bradycardia, bronchospasm, angioedema, methylglobinemia, visual impairment, porphyria, agranulocytosis, don't know how to say that, AB block, and there's a couple more of symptoms that you could get for severe symptoms. So I really liked it. I really like how they break it down from like, you know, really mild symptoms, not to worry about, from like severe, you know, symptoms. So we looked up the drug. We found the alternative name, which we saw that it was Metoprolol or Riglin. There's two brand names that drug is known for. We found the indication for the use. We saw that this drug has a lot of use for treating different things and different routes and recommended dosages that every single use is for. Just because when you use it to treat, for example, nausea post-operation, doesn't mean that the same dosage is gonna go when treating an induced nausea for chemotherapy, prophylaxis and stuff like that. So I really like how this website really breaks it down. It tells you for this certain treatment or that you're going to be using it for, this is how you're going to give it, either intramuscular, intravenous, oral, whatever. And it tells you here's the dosages for an adult, for a child, for a teenager, and how often you would give it. And lastly, we saw the symptoms or the side effects that this drug could give from mild to severe. So yeah, hope you learned a little bit about this drug, and I sure did learn a lot. And now you know what this drug, and a little bit more information about this drug.